On November 19th, 2025, something extraordinary happened so quietly on CDC's vaccine safety page. It says vaccines do not cause autism is not evidence-based claim. It's a big change. Worldwide, medical communities, patients, other countries, healthcare policymakers depend on CDC recommendation and what they approach. Before this update, it said studies have shown there is no link between receiving vaccines and developing autism spectrum disorder. Now, the claim vaccines do not cause autism is not evidence-based. That is a big shift. Just 20 words ignited the outrage among scientists, physicians, and public health workers around the world. Why? Because for nearly 25 years, the evidence has been remarkably clear. Vaccines are safe and do not cause autism. So in this episode, we will unpack exactly what has changed, why didn't there was any data presented, and how come CDC now can ignore 25 years worth of studies and create a doubt in public. Vaccines have saved 150 million children in past 50 years. How they added decades of life to human life expectancy, and why continuing this truth clearly has never mattered more than now. We know political environment is different, and this is a playbook from Robert Kennedy Jr.'s all the belief system, which is partially reflecting here. Why CDC statement matters for public, what the scientific evidence shows about the vaccine and autism. Vaccine changed the course of human survival, how lives have been saved child by child, country by country, and also how confusing communication it is today. The doubt fuels confusion, which will lead to policy changes and possible deaths. This is not something to be ignored. And finally, how we can improve as clinicians, educators, and public in general. At the dawn of 20th century, infectious disease ruled. Smallpox, polio, measles, routine childhood killers. In 1900s, US life expectancy was just 47 years. By 1950, after first modern vaccine, it jumped to 68 by 2020, and now 79. Smallpox killed 300 million people in last century, eradicated completely by 1977. Polio paralyzed 16,000 Americans each year. The last US case was in 1979. According to prestigious journal Lancet, 24 global immunizations since 1974 have saved 150 million lives and 101 million infants. That is 6 lives saved every minute. Vaccine didn't just lengthen life, they redefined what childhood could mean. Measles, 2.6 million deaths per year in 1980. By 2023, it's down by 83%, 16 million saved. HIV vaccine, pneumococcal vaccine, they are saving life up to 90 to 95% drop rate in vaccine, 90 to 95% vaccine preventable diseases. These statistics are not just to impress you, it's the name that never reached obituary page. Now, back to controversy. After CDC's update, many asked, did new evidence emerge? None. In 2014, a meta-analysis covering 1.25 million children found no link between vaccine and autism. In 2019, there was a big study involving more than 650,000 children confirmed that MMR vaccine does not cause any autism. Study done by Institute of Medicine echoed the same results. Vaccines do not cause autism. The origin of this almost cinematic story started in 1998 A scientist, Andrew Wakefield, published smaller studies. In one study, there were only 12 children, other was 18, and he just shook the medical community because that study made it to Lancet and started the conspiracy theory. They could not confirm any cause and effect relationship with any vaccine. Then they start looking into adjuvants, whether it's thimerosal based or albumin based, never have been confirmed. Because correlation feels convincing. Autism diagnosis rose while vaccine schedules expanded, but the diagnosis criteria and awareness changed. Autism diagnosis rose while vaccine schedules expanded, but the diagnostic criteria and awareness changed and not biology. Because language matters, when CDC repeats no link with no evidence based, it is open the door for doubt, but it opened the door to doubt without presenting any new data. Because fear spread faster than nuance, one viral headline can undo years of progress. That's why framing and transparency aren't the cosmetic, they are clinical tools. As physicians, we stand at the intersection of science and trust. Patient will ask, "Doctor, did CDC change its mind?" Here's how to answer. CDC changed just wording, not the data. No new study has been published. A recent conversation with one of my patients was very difficult. Mother was very scared whether the vaccines will lead to any kind of complication to his children. Look at the pain and plight this confusion will cause. Autism develops before vaccines are given. Vaccine ingredients like thimerosal were removed from all vaccines to my best of knowledge in 2000. All vaccines are safe and millions of lives have been changed. So how do we rebuild clarity? Demand consistent wording from public institutions, pair statistics with human stories, anticipate misinformation before it blooms, highlight the scientific revision means transparency, not reversal, and in digital medicine, our voices matter. Doctors, educators, and creators. Vaccines saved us once. Our communication will decide if they can keep it doing. Vaccines have saved more than 150 million lives, added decades of life, and continue to protect millions each year. Every credible study, Lancet, Annals of Internal Medicine, Institute of Medicine, CDC, converge on the same truth. Vaccines do not cause autism. Vaccines prevent infectious diseases and protect us. Vaccines prolong our life and keeps us healthy and safe. So here is my challenge to you. Keep science public, keep compassion visible. When misinformation spread, answer with empathy and data. And when the message shift, demand evidence, not echoes. In this episode, I hope I was able to make a case that use your analytical mind, understand the evidence, and then decide for yourself. Don't let few people's opinion override 25 years of scientific studies and 50 years of evidence. This is Dr. Kundlas. I'm signing off. Like, share, and subscribe to our channel Kundlas MD, and I will see you in one of our videos. Thank you.